Welcome friends, welcome to Trichy Madhu Education. This is our video number 24. We are going to see something about blood. Before that, if anybody not subscribed to our channel, please subscribe to Trichy Madhu Education. Like, share to your friends. Click the bell button for continuously getting the notification of our videos. Thank you friends. Now we are going to see about blood. Lymphatic system. Fluid connective tissue composed of plasma and blood cells. Blood is a fluid connective tissue composed of plasma and blood cells. An adult person has 5 to 6 liters of blood. It is slightly alkaline, having pH of 7.3 to 7.4. Plasma is pale yellow, transparent, and constitute about 60% of volume of blood. In blood, plasma is a pale yellow, transparent. 60% volume of blood is plasma. Plasma is composed of 90 to 92% water, 7% organic substances, that is albumin, globulin, and fibrinogen protein, and 1% inorganic substances. So the contents of blood as composition as given. Next one, red blood corpuscles, most abundant, are non-nucleated and contains hemoglobin, the respiratory pigment. Red blood corpuscles, it is more abundant in blood, are non-nucleated and contains hemoglobin, the respiratory pigment. White blood corpuscles are colorless, nucleated, and granular or agranular. That is, white blood corpuscles are colorless, nucleated, and granular or agranular. Eosinophils are also called acidophils. 2 to 8% is there, are phagocytic granulocytes and play important role in hypersensitivity. Eosinophils are also called acidophils. 2 to 8% are phagocytic granulocyte and play important role in hypersensitivity. Basophils are in 2%, are non-phagocytic granulocytes and increases during chickenpox. Neutrophils, 65% are neutrophils. Neutrophils are phagocytic granulocytes and increase during bacterial infection. So the composition of blood is that there are red blood corpuscles, white blood corpuscles, eosinophils, basophils, neutrophils. Platelets is also there. Red blood corpuscles are most abundant, non-nucleated, and contains hemoglobin. White blood cells are colorless, nucleated, and granular or agranular. Eosinophils are also called acidophils, which are phagocytic granulocytes and play important role in hypersensitivity. Basophils, 2%, that are non-phagocytic granulocytes and increases during chickenpox. Neutrophils, 65%, are phagocytic granulocytes and increase during bacterial infection. So neutrophils increase while during bacterial infection. Basophils increase while chickenpox. Eosinophils are responsible for hypersensitivity. They play an important role in hypersensitivity. Next one, monocytes, lymphocytes, platelets. Monocytes 0.5%, 0.5% are agranulocytes called policemen of blood and increase during tuberculosis. Monocytes are called policemen of blood and increase during tuberculosis. Monocyte will increase during tuberculosis. Lymphocytes, 26%, are agranulocytes producing antibodies and increase during viral infection. Lymphocytes increase during viral infection. Monocytes increase during tuberculosis. So monocytes are 0.5% in blood. Lymphocytes are 26% in blood. Platelets, thrombocytes, are non-nucleated. Platelets have a lifespan of about 8 to 10 days. Platelets are also called thrombocytes, are non-nucleated. Platelets have a lifespan of about 8 to 10 days. RH factor discovered by Landsteiner and Wiener in rhesus monkey, which is responsible for erythroblastosis, Fetal's disease. Important component of blood clotting are fibrinogen, prothrombin, thromboplastin, calcium ions, and vitamin K. Important components of blood clotting are fibrinogen, prothrombin, thromboplastin, calcium ions, and vitamin K. So we have seen the composition of blood. Blood is fluid connective tissue composed of plasma and blood cells. An adult person have 5 to 6 liters of blood. It is slightly alkaline, having pH of 7.3 to 7.4. Plasma is a pale yellow, transparent, and constitutes of about 60% volume of the blood. Plasma is composed of 90 to 92% of water, 7% organic substances, and 1% inorganic substances. Red blood corpuscles most abundant are non-nucleated and contain hemoglobin, the respiratory pigment. White blood cells are colorless, nucleated, and granular or agranular. Eosinophils are also called acidophils. 2 to 8% in blood, are phagocytic granulocyte and play important role in hypersensitivity. Basophils 2% are 2% in the blood, are non-phagocytic granulocytes and increases during chickenpox. Basophils increase during chickenpox. Neutrophils 65% are phagocytic granulocytes and increases during bacterial infection. Monocytes 0.5% in blood are agranulocytes called policemen of blood. Monocytes are called policemen of blood and increase during tuberculosis. Lymphocytes 26% are agranulocytes producing antibodies and increase during viral infection. Platelets are also called thrombocytes or non-nucleated. Platelets have a lifespan of about 8 to 10 days. Next one, RH factor discovered by Landsteiner and Wiener in rhesus monkey, which is responsible for erythroblastosis, Fetal's disease. Important component of blood clotting are fibrinogen, prothrombin, thromboplastin, calcium ions, and vitamin K. Once with this will come to the end of this video. If you like this video, subscribe to Trichy Madhu Education, share to your friends, click the bell button for continuously get the notification of our videos. Thank you, friends.